Welcome to Care Lab.
No. This isn't Care Lab. This is Care Lab Hot Takes.
Okay, so what are hot takes?
Hot takes are when we talk about a caregiving issue that is happening right now, affecting us now.
Oh, so let's get started. And if you like what you hear, make sure you like and subscribe.
Hey there, welcome to Care Lab.
Hot takes.
Hot Takes. All right. Are you ready to dive in?
I am. What are we diving into?
Okay, so back during the Biden administration, they imposed a new law that was set to take place. I believe it was going to roll out in 2026.
Okay.
Don't 100% quote me on that, but I believe it was going to happen in 2026.
Was being the key word.
Was, yes. And that was to increase staffing in nursing homes. We all know nursing homes often have a terrible reputation, right? People don't get enough care. They're sitting waiting for a long time. One of the reasons for that and by the way, not all nursing homes are created equal. There are some really fantastic places out there. There are also, of course, places that are struggling, right?
Yeah.
But one of the primary things is if we don't have enough staff to take care of people, then no matter how good our intentions are, we're not going to be able to do a very good job taking care of people, right?
That's right. You need hands-on care.
Yeah.
This is the literal reason why you're there.
That exactly right. So that law was made to kind of address that. Basically, CMS was going to require places that accept Medicaid funding, who is the largest payer for nursing home care, to have a higher staffing ratio to the residents that they were caring for. So more staffing basically was going to be required.
Put a standard on it.
Yeah, creating a standard that was going to increase where it was.
Yeah.
So now during the Trump administration, that law has not necessarily been taken away, but essentially the time frame for it to be applied has been extended to 2039. By the way, the first place that I learned about this was from AARP. I definitely recommend y'all don't just believe everything that you hear on the internet. Go check this out for your own on your own. And anyway,
we're trustworthy. We're
trustworthy, but you don't know who's trustworthy or not. So go check this out for yourself too, and kind of get yourself informed on it as well.
Yeah.
But so essentially the idea is now that this isn't going to be taking effect until 2039. And so, my initial hot take on that is, well, that's not a good thing.
I mean, that's a decade from now of not having additional standards that say increase your standard of care.
Yeah. But, and here's what I said, otherwise this would be a real short hot take, right? But I think that the bigger picture here is that maybe both administrations have missed the boat on something.
Now that's a hot take. Why do you say that?
Because yes, obviously we want to have more staffing in nursing homes in all levels of care, right? Yeah. The problem is that it's not just as easy as saying you must have this number of staff, right? Because what we need to know is where those staff are coming from. And we're talking, particularly for this law, we're talking about nurses and nursing assistants. And those are two groups of people who, as amongst all healthcare providers, there's a huge shortage of.
That's right.
Especially following COVID. A large number of people exited the industry at that time because it was pretty rough for providers.
Brutal.
It was brutal. And so we're already in a position where we're having to rebuild from that for years. Not to mention that working in a nursing home is not necessarily like the most glamorous form of glamorous is probably not the way to describe healthcare in general ever. But it might not seem like the most exciting thing to people. They might not necessarily be drawn to it. I will say that I worked in many long-term care facilities and skilled nursing facilities when I was first an occupational therapist. And I loved it, actually. I love caring for that population, but that's not necessarily where everyone goes, right?
Yeah.
So the bigger question here, and I think that what we're missing the boat on is not just saying you need to have more. We all know that we need to have more providers.
And a lot of those places are trying to get more providers.
They're trying.
And they're just functioning at whatever level they can function at in order to keep going because the people need care, but they were trying to find more people.
Exactly. It's not a matter of people not trying to provide the care or being like, oh, we're fine with staffing as it is.
Yeah.
The problem is that there is a staffing shortage to begin with. So how do we actually bring more nurses into the healthcare market? That's the better question to be asking and the better problem, I think, frankly, to be solving here. What do you think?
I think that that's exactly right. And also, at the same time that they're not putting this in place, and or thinking about the past time when they were trying to put this in place, we're also cutting out a large portion of the people who would be those nurses and nursing assisted with our changes in immigration. And so there's a very big percentage of people, especially at the CNA level, who come here and do that work. And so to make it harder for them to come or stay here is hurting that sector too.
I hadn't thought about it from that perspective at all, but that is so true.
Especially in nursing homes.
Especially in nursing homes, we really rely heavily on folks who are willing to come in and do these very difficult jobs for not a whole lot of money, right? And so when we cut that off, sort of like we're cutting off our own hands.
Yeah.
To try and provide this care. So I think that there are some things that would be really simple to do that wouldn't require huge changes to how our healthcare system functions. That could actually help to increase our supply of nurses and frankly other healthcare providers too, and funnel them into this high need area.
What's that?
Okay, I'm so glad you asked.
Yes.
So there have been programs for a long time where, for example, doctors can get medical school paid for in order to exchange for service in certain areas.
Mostly rural areas. Which we still need a lot of.
Yeah. We also pay for people to go to college or medical school or other things, and then in exchange for military service, right?
That's true.
Why are we not offering things like loan forgiveness or assistance with tuition in exchange for people then going in and working in these clinical settings where we really, really need people? It wouldn't be that hard to do. And the amount of money that it would save us in the long term against the healthcare dollars that are being spent when people don't get good care in nursing homes and then have medical issues because of that would probably pay for itself multiple times over.
Yeah. I mean, because to put a real fine point on it, it's like if somebody falls in a nursing home, their current care is being paid for by Medicaid. Our government is a pot, one pot of money. We talk about all these different things, but it's really one pot of money, right? It's coming from our taxes. Medicaid is paid for their stay there. Now they're going to the hospital.
And Medicare is going to pay for that.
I was about to say that Medicare is going to pay for that hip fracture replacement that averages $30,000 in cost. I know we don't always all see that, but that's just ends up getting spent. And now they're going back to that same situation and in a worse condition, right? Because now they're healing from a hip fracture. When $30,000 could have paid for at least a couple of years of schooling for nursing and definitely pay for more than one person to get their CNA license.
Absolutely.
And that's just one patient.
Not to mention, I think the other thing, and it's going to feel like it's wildly off topic, but I do think it's relevant here.
Okay, I'll be the judge.
What do we need more of in this country? We need good middle-class jobs.
Yes, we don't have enough jobs.
What is nursing but an excellent middle-class job?
Yep.
Right?
Yeah.
And so if we could reduce the barriers to this industry, to becoming a skilled healthcare provider by making it financially accessible for people, and then be able to put them in decent paying jobs without $100,000 of student loans, what do you think would happen? Well, people would go to school to become nurses and then they would go into these jobs, right?
These programs work.
And then, there's nothing more important to an economy than a flourishing middle class. So there are lots of good reasons for this. Obviously, I got outside my area of expertise. I'm not an economist. I don't want to pretend to be that. But to me, that makes sense.
Yeah, this is a bottom up approach to economy, right? We're not coming in from an economic perspective as a who?
Economist?
Yes, that word. Economist. We're coming at it from a healthcare perspective, and we see that in there. And then to add to that, if let's say we did this in the idyllic world, which we could do if there's anybody listening that can make that happen, then if I sign up to get this loan forgiveness because I'm going to go work in a nursing home, I can actually focus my education directly on elder skills, right? Which are a different set of skills than like the generalist skills you might get to be able to do peds and be able to do adults and be able to do everybody. No, I'm going to learn really quality information about like Alzheimer's management and like all the things that could be happening, low vision challenges, which we don't often have a lot of time to dig into in our education because you're learning about the full breadth.
Yeah. And a lot of times people go into healthcare and they think, I want to work in pediatrics. Like, I mean, how many people did you go to school with?
Almost everybody said they wanted to work in peds.
Everyone wants to work with kids. And then when people do start working with older adults, though,
and you love it.
They love it. And so why not create more opportunities and incentive to say like, yeah, I don't think it's going to be my cup of tea. I think I really want to work in pediatrics, or I really want to work in a trauma hospital, or I want to do XYZ. But in order to get my school paid for, yeah, I'll go spend 4 or 5 years working in long-term care. And then guess what? You kind of fall in love with those residents.
Yeah.
Because they're great.
Exactly.
It's wonderful. So anyway, I'm not saying, I'm just saying.
Just saying, hot take over here.
Hot take over here. And the big takeaway being like, do we need more staffing? Absolutely. Do we need to solve that problem? Absolutely. Yeah. But we should think about it from a root cause analysis instead of just saying
top-down legislation.
Top-down, like you have to do this, go figure it out. There's probably a more comprehensive way that's going to support everyone and make it really work for our whole country and all of our communities better.
So pass this podcast to your local representative.
There you go. All right. We'll see you next time on Care Lab and Care Lab
Hot Takes.
Hot Takes.
Bye, everybody.